Carter, Chief Executive of Bedfordshire Hospitals, and what we'll do is I'll just give a very short introduction to some of the background to the change, and then hand over to Paul Tizzy, who is both our medical director but also a consultant vascular surgeon. Luan, can we move on to the next slide? So just to reiterate, the purpose is really just a detailed brief of the trust plans to enhance the provision of vascular services and why this development is necessary, and then to understand what is planned, but also to allow you to ask some questions about both the patient and potentially the staff benefits that this will bring. Next slide, please. So the background to the plans is that the two hospitals merged back in April 2020, Luton Dunstable and Bedford Hospital. And since that time, we've undertaken a considerable amount of work to develop a clinical strategy for the new enlarged Foundation Trust. And within that strategy, we've outlined plans to develop and enhance the provision of vascular services across the two hospital sites. Now, Bedford and L&D have collaborated for many years around vascular services, and that collaboration has been in there for more than a couple of decades. And within that structure, the inpatient treatment was focused on the Bedford side. Subsequently, in 2012, the vascular network was formed, and that included the joining together as well with Milton Keynes Hospital, who had a population of around 275,000, giving us the current network where we're serving a population of around 1 million people. Next slide, please. So at the moment, just to recap on the way the service is currently provided. So at the moment, outpatient diagnostics and day case activity, it takes place on all three hospital sites, Milton Keynes, Bedford and Luton Dunstable, with scans at Bedford and MK, duplex scans. However, the emergency and elective inpatient activity currently takes place at Bedford, which is the current vascular hub. We want to develop vascular services further, and the main part of that is the relocation of the vascular hub from Bedford to the L&D. And what that would mean is that all major vascular surgery, both the emergency and the inpatient, would be delivered at the L&D with outpatients, diagnostics and day case surgery remaining on the patient's local hospital sites in either Bedford, L&D or Milton Keynes. Next slide. So I'm just going to pass you over now to Paul to give us a little bit of a bit of detail about why we want to make this development. Paul.
Thank you, David. Good afternoon, everybody. It's Paul Tizzy. I'm the medical director for the trust and a consultant vascular surgeon. I started, in fact, both at Bedford and Luton Dunstable Hospital back in 2001 as a consultant vascular surgeon. That was the earliest part of bringing sort of the vascular network together. So obviously there's been a lot of evolution since then in developing our services. With modern vascular surgery, we've got two types of operations, essentially. We've got conventional surgical operations through surgical incisions in the abdomen, in the legs, etc., or in the neck. And we've got so-called endovascular procedures. That's procedures done through an artery, which are less invasive. Some people term that keyhole surgery. Now, we currently tend to do those in separate units. We do our main operating in the operating theatre. Now, we sometimes need X-ray imaging as well in that theatre, and we have what we call mobile X-ray imaging or a mobile C-arm. Now, that is probably the best equipment that you can buy sort of in terms of that type of equipment, but it is not really good enough to give you that X-ray imaging for the most complex vascular procedures. So most vascular units in the country are now equipped with so-called hybrid theatres, which effectively incorporate a conventional operating theatre with very high quality X-ray imaging, which is fixed and can be moved in place for those parts of the procedure. What that means is we can extend the range of procedures that we can perform. For patients requiring both types of procedure, we can do that in the same session, which has clearly much improved benefits for patient outcomes and also shorter overall operating times. And with that modern equipment, there's also less exposure to radiation, which is both for our patients, but also most importantly for our staff, because our staff are being exposed to radiation repeatedly over a number of months and years. Now, of course, all appropriate protection is being used in our theatres, including lead aprons, etc. But you want a machine that delivers less radiation to give you the best possible imaging. Now, the next slide, please. So for those of you who know the Luton site, you see there's a very large acute services block in development. You'll have seen sort of 2 large cranes now down to 1 crane, which you can see from miles away. Now that gives us the infrastructure to actually further develop our vascular network. So within this new block, there are 8 new operating theatres, of which we've had 2 now dedicated to vascular, and both will be equipped as hybrid theatres. So one will be used predominantly for vascular surgical procedures with this hybrid option, and the second one, which we co-located, will be our interventional radiologists. So again, opportunity for those teams to work very closely together. In terms of the L&D site itself, it already hosts various other hyperacute services, such as the stroke unit, and that's really important for vascular surgery, particularly in some of those urgent procedures to prevent strokes. So having your services located on the same site does make a lot of sense. Next slide, please. So over many years, there's been evolution of vascular services in the UK. There was an original document published way back in 1998, and there have been multiple iterations since then, really trying to define how modern vascular services should be run in the UK. And it's now recommended there are around 40 units within the whole of the UK to deliver vascular services. Now, most of those are in teaching hospitals or very large district general hospitals. When the service was set up at Bedford, it was designed to cater for the local population. And as it's expanded to include both Luton and Milton Keynes population, we've increased the staffing, but of course the underlying infrastructure has not been increased. And therefore, I think effectively the service has outgrown its facilities. We think by relocating, we're going to certainly improve our patients' access to high quality treatments. We think we'll improve our patient outcomes. And there are also a lot of other benefits to this, which we'll come on to in the next slides. Next slide, please. So for the patients, shorter length of stay, less readmissions. We'll be trying to, with a new unit, which will have purpose-built wards and dedicated staff, will be able to offer 7-day services such as physiotherapy, podiatry service, and of course, offering a very urgent limb salvage service. Much of these acute emergency conditions are very time dependent, and you want your treatment as soon as possible. I think we've already covered the radiation protection, which is really important. And we hopefully will be able to repatriate some of the work we currently have to send elsewhere that's having to be done in these more complex facilities. So for some patients, that will be care closer to home rather than having to travel to London or Cambridge for more complex procedures. We're bringing it closer to their home. Next slide, please. We've talked about the co-location with our hyperacute stroke unit. We've got, as I mentioned, the limb salvage clinic. So we're intending to have 7-day services available for this, with dedicated slots for our consultants to see those patients and give them an urgent treatment plan. We plan to introduce some new services in the trust, such as a deep vein service. Now, you've all heard about DVT, sort of clots in the veins, and medical treatments. That's the acute clot, but actually many of these patients need a subsequent surgical procedure to prevent long-term damage to the leg, and this is something that we can now start to offer. And as the service matures, we can start developing other services, such as embolization, which effectively means blocking areas of bleeding, and that might help preoperatively in some situations, such as from cancer surgery, and also dealing with acute bleeds from gastrointestinal conditions or obstetric conditions. And again, some of this work is having to go elsewhere, but we have an opportunity to repatriate that work and actually grow our service. Next slide, please. What about the staff? I think this is really important. Our staff are key, and without that, we really can't run a modern, high-quality service. So we have opportunities for training and development of our staff, new education opportunities. I think having the new facilities, the new hybrid theatres, and also new intensive care units as well in the hot block, that's going to be a very attractive option to recruit new staff and, more importantly, to retain the staff. We'll also expand some of our other services, such as our vascular labs, which are our diagnostics. We'll also expand our support staff, including our radiographers, who actually help support this X-ray image. Next slide, please. We'll have a specialist ward, and we can actually co-locate elective and emergency patients. Be compliance with all our national guidance. I think that's really important. and particularly our Vascular Society, which is the professional body, will be able to demonstrate that we're meeting all the requirements for this service. And I think this will also have the opportunity on Bedford site to release theatre capacity for other service developments. So perhaps increasing more access for Bedford patients for other surgical procedures. Next slide, I think the last slide. So this, I won't go through this line by line. This just summarises our current configuration and what will happen in the future. But the key points to note is that for day case procedures, day outpatient work, all our service will be maintained in both Bedford, L&D and Milton Keynes Hospital, which is part of our network. But effectively, we're moving the hub for the arterial procedures, routine and all the emergency work to the Luton site rather than the Bedford site. And obviously then developing new services as we've already covered. I think that's the last slide. So timeline, Dave, don't know whether you want to cover the timeline for that.
Yes, thanks, Paul. So just in terms of running through the timeline, we've obviously developed the proposal back in 2020. We're now and ongoing going through a process of staff, patient and public engagement, of which, of course, this is part. There's quite a lot of work to do. As Paul said, the building is going up at Luton and the development of the hybrid theatres. But in the meantime, till that's up and running, we've got to do the capacity planning around the changes to the service coming here, but also, and really importantly, the development of the workforce plan, making sure that we've got the workforce at the time when the hub transitions, and we'll be doing that transition process right through the next couple of years. In terms of when we finally change, we haven't yet finalised the plan for when exactly the move of Vascular will take place. We're expecting the completion of the build at Luton to be in place from sometime at the start of 2025. But then we need to decide how to program in vascular services as part of that move. It's the only service in that new building which is transferring from another site. All the other services are transferring from the L&D site itself, so they're a bit more straightforward. So we will finalise that date relatively soon. But that's the timeline through from now until then. Next slide, please. So just finally, if you've got any queries about the proposal or would like more information, there's a couple of emails up there, which will hopefully people will have access to, or in fact, and there's also a number you can call. But we can probably take the slides down now and open up to any questions.
I think, as Luana has said, I think any questions currently will be on the recording. So if people wish to ask questions that are not recorded, then we'll leave those to the end.
Can't currently see any hands, but if anyone wants to, we have Erin.
Hi, sorry. My name's Erin Lee. I'm a podiatrist at Milton Keynes Hospital. I just really had a couple of queries around sort of things like endovascular, the angioplasty services at Milton Keynes.
Yes.
And if they would be moving at all.
So at the moment, I think the service isn't fully integrated with Bedford, so there's no immediate plans to move the current angioplasty service. But clearly, if the radiologists wish to come and work in the units, those options are open, and those discussions will be ongoing. Currently on Bedford site, we undertake the angioplasties. We'll be moving that to Luton Dunstable Hospital. And technically, we could undertake the Bedford site, but I think with the state-of-the-art facilities, then we'll be doing the Luton site. We do know that there are very few very straightforward angioplasties anymore. The complexity of work is increasing, and in the hybrid theatre with all the relevant kit, stents, etc. I think it is focusing all that expertise in one place. But those dialogues with colleagues are, I believe, okay.
Okay. I also just wanted to ask a quick question about the limb salvage service.
Yeah.
So I can't remember if it was Leicester had sort of one of the first models of limb salvage centres. I can't remember if it was Leicester, and what sort of, if you're basing it on a similar model to those that have already existed throughout the country.
So we haven't got Nadeem as our clinical director on the call. I think he's leading on the planning of that aspect. But the intention is really, we already do run hot clinics for limb salvage, but the intention is to try and make that a 7-day service for those critically ischemic legs, basically with consultant availability, we have 7-day consultant service of vascular course anyway on site and Bedford. That'll be moving to L&D, so there'll be a consultant available 7 days, but you really want those treatment plans implemented. But I think that's a good point. I think we can sort of direct the name more to that unit. I'm sure he's aware of it.
Thank you.
Thanks, Erin. Any more questions from anybody? Can't see any hands at all. Okay, so if there's no questions, obviously there are the query, the 2 email addresses. So if there's anything that people do want to know outside this forum, then please do email those addresses or call that number. We'd be very happy to answer any more detailed queries outside this. If that's everything, then it just remains for me to say thank you all for attending this afternoon. It's a really massive opportunity, I think, for us to really improve the vascular services that we've got across the county, and so hopefully this will, in relatively short order, provide a big boost to the way in which we provide vascular services, not just for our staff, but also for our not just for our patients, but also for our staff and the way that they provide that service. So thank you very much, everyone. Hope you've received the information that you need, and thank you very much for your time. Thank you.
Thank you.